Pandemic COVID-19. So, what is COVID-19? Coronavirus disease 2019, also called COVID-19, is caused by a virus that can be passed from person to person. It first appeared in people in December 2019 and has quickly spread around the world.
COVID-19 affects your respiratory system. In some cases, it can cause problems with our lungs, like pneumonia. There's a lot out there about COVID-19. Guidelines and recommendations are changing quickly as we learn more about the virus and how it acts. Trying to keep up with what to do and what not to do can be confusing and overwhelming. So, let's break it down. Let's talk about what is going on and what practical steps that we can take to keep in those around to be safe and healthy. How does COVID-19 spread? The virus spreads through droplets. So when an infected person coughs or sneezes, the project droplets of the virus out into the air. Those droplets then land on or are breathed in by other people. That's the most common way the virus can spread. Another way it can spread is when those infected droplets land on surface like door handles. If a healthy person touches the surface that has droplets on it and then touches their eyes, nose, or mouth, it's possible for them to get sick. There are gateways for the virus, so the less you touch them, the less chance there is for the virus to enter our body. That's why everyone keeps saying, don't touch your face. If the virus gets on our skin, like on a hand, we want to wash it off by using soap in water or hand sanitizer before it reaches our eyes, nose, or mouth. It may be possible for a person with COVID-19 to pass the virus to others when they are not yet showing signs of being sick. This is called asymptomatic transmission. It often takes 2 to 14 days before people start to feel sick after being exposed to the virus. So we could be getting other people sick about knowing it. That's why when there are a lot of cases of COVID-19 in an area, leaders recommended staying home unless we really need to do something, like get groceries. And if we are feeling sick, stay home and call the doctor. And what are COVID-19 symptoms? Signs of being sick with COVID-19 are a fever, cold, body aches, and trouble breathing. Some less common symptoms of the virus include headache, sore throat, runny nose, problems with sense of smell or taste, nausea, and diarrhea. It can seem like anything can be a symptom, so if we are not feeling well, stay home and call the doctor. Most people who get the virus will experience mild symptoms. Some people won't experience any symptoms at all. Most people, including children who get sick with COVID-19, can recover at home. But for some people, especially people who have 65 and above, people have other health problems like lung conditions, diabetes, and heart disease. And for people whose immune system or infection fighting system doesn't work so well, COVID-19 may lead to more serious problems that requires hospitalization. What should I do if I'm feeling sick? If you are feeling sick, have a fever, have a cough, or having trouble breathing, call our doctor or local urgent care facility. This is important. Call first, and if we are sick, cover our nose and mouth with a cloth mask, scarf, or handkerchief. It will help protect the people around us. If we live outside the US, check with our National Health Agency on mask recommendation. When we call, our doctor can tell to us what to do next. Some people may need to come and be seen by a doctor, and some people may need to stay at home and limit their contact with other people. Our doctor can tell us of what should do. What should I do if I'm worried I've been exposed? Our chances of exposure to the virus that causes COVID-19 increases if we were within 6 feet of someone who is infected, about the length of a bit away from them. Live in or have traveled to a location that has a lot of cases or we are at a crowded event with someone who is infected like a party. If we think we've been exposed to someone who has COVID-19 but are not having any symptoms, call our doctor, hospital, local urgent care facility or public health office. They can tell us what to do next. If we think we might have been exposed and we have symptoms like fever or cold, we should call before going to our doctor's office or to hospital. Our doctor can tell us what to do and if we need to be seen in person. If we are asked to come to the hospital, we'll be asked to follow special procedures like using a special entrance away from other people and covering our nose and mouth. It's important to know that currently there is no proven treatment for COVID-19.
But doctors can help support your breathing and make you as comfortable as possible.
Most people will not need to stay in the hospital and will be able to make a complete recovery at home. What can I do to stay healthy? Wash our hands with soap and water. We know it's simple, but this have a big impact. Basically, it's because soap breaks apart the container that holds the virus. Once the container is open, the virus just washes away with the water. For this to happen, we gotta spend some time washing our hand and we need to scrub. We want to wash our hand for 20 seconds. You want to rub our hands together, clean your wrist, fingernails, and between your finger, and dry your hands with a paper towel you can chew away. Lastly, turn the water off using the paper towel instead of your hand. If we are not around, soap in water, use hand sanitizer that is at least 60% alcohol. Make sure to rub it in until it's dry. What else can you do to stay healthy? You'll want to keep your distance from other people. This is called social distancing. And we really want to stay away from other people who are visibly sick or coughing. And if we can work from home. And speaking of home, clean surfaces that we use frequently. Clean doorknobs, countertops, phone screen, and other items we touch a lot. Lastly, it is a good idea to limit travel to places that have a lot of COVID-19 cases. What doesn't help protect you against COVID-19? Someone sneezes or coughs around you. The virus can be passed in multiple ways, so not breathing around people doesn't really do anything. I know COVID-19 sounds scary. Most people, COVID-19 is a mild infection that is not life-threatening. You can do a lot to keep yourself and others healthy by washing our hands, staying away from people who are sick, wearing a face covering, and practicing social distancing. Remember, if we are feeling sick, stay home and call our doctor. By taking these practical steps, we can protect ourselves and those around us and help slow the spread of the virus, and we can stay up to date with the latest updates. Thank you. That's all. And I hope you listened and learned.